She's been a float nurse long enough that she is trained and proficient in all the areas, just like the staff on that floor would be.
Being on the float team, we get trained on all the floors. So we will go to our orthopedic floor, medical floor, cardiac. I go to ICU, I go to home health, pediatrics. It doesn't matter what floor I go to. I feel really comfortable with everyone, and it's nice to, I mean, I know everyone, you know so many more people that way too.
We're a special breed. Like, you have to have the personality to be able to call in the morning for your shift, and just, they'll tell you where you're going, and then maybe halfway through your shift you'll go to a different unit.
And I call in the morning prior to my shift and find out where I'll go for the day. And that's the floor I go to for the day.
I always describe Marsha as a ray of sunshine. She is happy wherever she goes.
It's really nice because it doesn't matter what floor I go to. I know so many people all the way from physical therapy to respiratory therapy, but then all the nurses and doctors on all the floors too. You
get notified probably about an hour or two before the start of your shift who your nurse is going to be. And of course, people are excited when they hear that it's going to be Marsha, because you know, she's just a really, really capable nurse. She's also just very, very smart. She's very efficient. She's just an excellent caretaker. She was made to be a nurse.
You're seeing a lot of people on their worst days. They don't feel well, you know, whether they're in pain or just whatever is going on, or they're scared or whatever, you know, and I always try to be as sympathetic as, to them as I can. And usually, as long as I explain things the best I can and make them feel as comfortable as I can, they usually, feel so much better and more comfortable about everything.
She's also pretty strong-willed, so she's a really, really good advocate for her patients, which is important, especially when they can't be that voice for themselves. So she's the whole package, and so it was really, really exciting to be able to nominate her. I was given the opportunity to nominate Marsha, but it was really, really nice because Marsha's just one of those people who gets recognized all the time by fellow staff members as well as patients. But I went over her review just the other day, and she had so many nominations for Bell and Stars, which are like peer nominations, and so it was really, really nice to kind of be able to put them all together and show the kind of nurse that Marsha is all the time. There's so many days you walk out, and you feel like you did the best you can, but nobody really acknowledges anything, or patients just didn't feel good all day. They're just so grumpy all day. It's just, oh my goodness. So to have either a family member or a patient really appreciate your hard work and sees how much you're trying to help them, that just really does, at the end of the day, you're like, I am doing this for a good reason. That really helps. Congratulations, Marsha, on winning this award. You are very, very deserving of it, and we're really excited to have all the hard work and dedication that you've contributed over the years finally paying off.